Hey everybody, this is Brian Boyle. Welcome to episode 65 of The Mesh Tongue. And hopefully you're having a great Monday and great start of the week. Keep those questions, those comments coming in. I've got lots of them coming in this weekend, so congratulations to all those that had some fantastic races this week. All those folks getting their long runs in, and those that are just feeling better in general. Keep those good vibes going, and hey, get after it. So you can send those emails to Brian, B-R-I-A-N, at company5k.com, and that's K like kitten.com. So today I want to talk to you about trochanteric bursitis, or bursa of the hip. Okay, so the hip has a bursa right on the bone, so if you kind of feel that hip and you rotate your leg in and out, okay, right on the side here. This is pretty common in runners, especially if you've got some weakness at the glutes, and that's glute medius per se, or piriformis also if you do a lot of sitting. So maybe you're sitting at your desk an awful lot. Quite oftentimes these get really weak. They're hip external rotators. When the hip external rotators get weak, the hip will internally rotate. You may see the knee kind of cave in, and it's possible to get this kind of sore pain right on the side of the hip here. Okay, so I'm going to show you a real easy tape job to help with that. You can use ice to help alleviate some of the symptoms. Some of the other exercises that I've shown you for hip, can certainly help to hip strengthen, so the glutes. You might have to open up the IT band as well. If you are having issues and you aren't getting benefit from some of these things, you may have to go in and be seen and sometimes get some soft tissue work done on that IT band. Sometimes, in clinic we can scrape that down. In really severe cases, sometimes an injection is necessary, but very rarely is any of this surgical. So, like I said, without further ado, one of the very easy tape jobs that you'll do. So what you're going to do is you're going to take 4 strips of your kinesiotape, so you just grab your kinesiotape. I cut them down to about 5 inches, okay, about four strips. And what you're going to want to do is, again, you want to curl those, make sure that these are rounded. What you're going to do is you're going to take the first one, you're just going to back that off, take the back off, and I'll show you here. Normally I don't show you this much leg, but today I'm going to show you some. So what you're going to want to do is cross the leg over, find that bony part right there, and it's important that you have the leg on a stretch. Okay, so we're just going to take the first piece, and we're just going to apply this. And again, you're going to put a little bit of stretch on it, but you're going to have that stretch on the leg as well. Okay, so that goes right over the bone. And we're just going to repeat this in a star pattern. Okay, so we're just going to cross this over. If you can't reach yourself, have a friend do this. You can put a little bit of a stretch, apply some stretch, and then back off. Okay, so you can see so far we've got this X pattern. Okay, we're going to apply 2 more pieces, and we'll create that star. And it's important to have this on a stretch, and the reason being, okay, is that you want to have the lift from the tape. All right, last one here. And so again, just crossing the leg over, and you can see, even for somebody like myself, this isn't always the easiest. So like I say, if you've got a friend, you can help apply, okay, but that should be right over that edge of the bone, so you can rotate back and forth, so that center piece right there is right over, okay. Shouldn't restrict any of my movement. Smooth those edges out. And what that should do is it should help lift the skin, allowing the bursa and the underlying tissues underneath to get a little bit of relief. But leave that on 3 to 5 days. You shower with it on, you pat it dry, you can run, you can do whatever you want to do with it, okay? But as I said, real simple. It's 5-inch strips, 4 of them, put them in star pattern, center it right over that hip joint, okay? So you kind of rotate the leg back and forth, and you should be able to feel that bone, find that bone, and then apply the tape right over it. Make sure that you've got the skin kind of prepped beforehand, especially if you've got hair on your legs like I do. That tape might fall off, so make sure you've got that, get that set. So hopefully you find some value in this. If you do, share it with your friends, your family, your training partners. As I always say, don't go hurting yourself to come back, but this is Brian Boyle, episode 65 of The Mesh Tongue. Check out runpainless.com, and I'll see you again tomorrow. All right, take care.